At the time of recording, we got the terminology for PGD incorrect. It's actually standing for Preimplation Genetic
All
Diagnosis.
right, everyone. Welcome to this week's or this fortnight's episode of Pebbles Rebels. As always, I'd like to start off by acknowledging the traditional custodians of the land and pay respects to elders past, present, and emerging. And this week, we are actually interviewing one of our own, Bernie.
No,
Yay!
I need no introduction, please.
So, we're actually covering a very interesting topic this week. We're actually covering off what is called PGD. And what does that stand for, Bernie?
Pre-genetic diagnostics
Yes,
for
thank you.
IVF.
Yeah, so thank you. I couldn't remember that. And this is because, as we've mentioned in past episodes, if one parent has neurofibromatosis, there's a 50% chance it can be passed on to their child. And if both parents have NF, then there is a 75% chance that it can be passed on to the child. So, what PGD does with IVF is to ensure that the NF does not get passed on. So, it essentially saves this baby or this child from a lifetime of the chaos that NF brings into your life. So,
Definitely.
um, I will hand over to Kirsty to ask the first lot of questions.
Yep.
I haven't even thought of a question if I'm honest. um,
Um,
yep, brain.
okay, I'll jump in. Bernie, do you want to actually explain the process first up?
Sure. It's on the face of it, it's pretty. I'll give a pretty basic rundown. First of all, when me and my wife we went to our GP, and he wrote us a referral to go and see the IVF specialist. And said, "Look, I've I'm the one that's got the neurofibromatosis type 1." And they said, "Great. You have to go I went to Westmead to get a blood test done, which had to be sent to the US pretty quickly. I think from memory, that was about $1,000 just for a blood test. Um, some people say, well, why do you have to get a blood test? Because we know NF is on chromosome 17. But as was explained to me a few weeks ago by Janu and Janu's boyfriend, um, everyone's gene sequence is a little bit different. So they still have to pinpoint where exactly on my genes the mistake is. So that blood went to the US, and then they had to get the results back. And then it's basically the same IVF process as normal. Um, the lady, has to go through the hormones and everything to get the production of the eggs sped up and then harvested. And while they're being harvested, I have to go and make my donation. Um, it takes the romance out of baby making completely. Um, and yep, so my wife, she had to get her eggs harvested, and I've got to say, I was right there with her, and my heart goes out to all the women who do IVF because it's not a pleasant experience getting this big ass needle. I swear, it felt like a foot long being inserted inside her. Um, and they count the eggs as they go along. They're like, oh, congratulations, we've got one full one, another one. And then they insert the sperm into the egg or eggs, depending on how many there are. Sometimes it could be 5, 10, 20. Um, and then that goes into an incubation period where the eggs will like gestate. some will just naturally die off. So with whatever's left over, they have to take a sample or a cell from each one, and some will have the NF, and some won't. Unfortunately, in our first case, I think they had about 5 eggs or so, and every single one of them was infected with the NF, which was absolutely heartbreaking. Um, and again, people will say, well, how's that 50-50? And it's just like, well, out of 5, that's a very small sample. But if you had like 100, it would probably be more like 40-50 or 50-50, 60-40 or whatever. So sorry. So we had to go for a second cycle, and yep. So that happens, and then once they find one that's viable, that doesn't have the NF, then that gets implanted into uh, the womb, and then it all goes from there. I know that sounds very basic and that sounds very quick, but that's basically it. But they do say, look, this is a 95% chance that is successful. So there's still that little tiny 5% chance that um, the child can still have NF, which just it did my head in. And for years afterwards, after my kids were born, I'd get nightmares that the kids have NF. So that's basically the long and the short of it. Um, I I didn't know. I knew we were doing this tonight, but I didn't wasn't expecting it would be that short. I'm sorry.
You're on mute, Jenny.
That's that's fair. It's
Yeah.
quite an emotional process, and like hats off to you for sort of actually being so vulnerable and sharing this. Can you sort of give us a little insight into how like the time frame, sort of like from when you started, like I guess the process where your wife was given medication to speed up the process of the egg production to harvesting the eggs to adding the sperm and
Yeah. Oh, that's a good question. I should have thought about that one. Um, about the same. Well, I've got to say it's the same time frame as a normal IVF process.
yeah,
It varies from woman to woman on what dosage hormones they're given because we had to inject the hormones ourselves, and the nurses and doctors at the place we went to were absolutely fantastic. They said, "Look, this is the measurements for your age, for your weight. Um, so give." I can't even remember the measurements. I'm so sorry.
that's
Um,
okay. That's quite personal, so you don't have to go into those specifics, but if you
but yeah,
can
it's
give
the
us
same. Most of it is the same process and
Mhm.
length of process as a normal IVF. They just go into that extra step once the cells, once there's enough cells, they do the genetic test on it. And the whole process from when you go to the GP, you get the referrals, then you go for the blood test, and then it probably took us up to a year to get everything lined up. And we did have to go and see a counselor to see if we were like emotionally ready as well. We had to be tested for STDs, and yeah, it does feel very invasive.
it sounds like it, and sounds like it takes a lot of gut, pardon me, a lot of guts to go through the
Mm.
process.
But the payoff is worth it. And for those people who are watching this, do it. If you have the means, do it. It's also very financially stressful as well. Back in 2009/2010, before any kind of rebates, it was costing us $16,000 per cycle, and that was yeah. We had to do 4 cycles for two kids, and we were in NIB's top cover, and I think we probably got about $3,000 to $4,000 back per cycle.
So, so a cycle, I'm guessing, is the process of implanting the sperm into the embryo, into the egg, and then creating the embryo, and then checking the embryo to see if it's viable, and then implanting it if it is viable, and then seeing if it takes. Is that correct?
Yeah, that's it. The whole hormone injections.
Oh, so it's
So yeah,
right back to the hormone injections. Like that's part of the cycle too.
yeah, right back the whole kit and caboodle. Unfortunately, because yeah, we got to have enough eggs to harvest.
Yeah.
Um, so I felt so guilty that my wife Michelle, who had to go through all of that 4 times. Um, so yeah, the first cycle was a bust. The second cycle was almost a bust. Because what they do is they insert a fresh egg. What I mean by a fresh egg is once the sperm
Freshly
goes into
harvested.
the egg, um, if that's viable, it gets inserted, and the others get put on ice. Now, my daughter, our firstborn, she was actually a frozen embryo. So, and that was an extra $5,000 on top to just to defrost and in you go.
That's crazy.
And the third cycle was a bust, and the fourth cycle, my son was a fresh embryo.
Sure. And was there any Medicare rebates at the time at all
Oh,
when you did?
zero Medicare.
Yeah. So for anyone listening, we can't comment at this point what the Medicare rebates are, but we will sort of do a bit of research and we will add something into a future social media post that might give you some insight into what options there are. But again, we can't guarantee what you'll get because everyone's individual circumstances are different. So
Yeah,
this isn't medical advice.
absolutely. This is
Also,
just going off my experience. I mean, this was 16 years ago, so rebates could have changed, technology could have improved, making the process easier or cheaper. So yes, please, for whoever's listening, um, yeah, those prices uh, would be out of date by now.
and just
And
to go
please
back
talk.
to the NIB thing, that's a health insurance company, I'm assuming.
Yes, NIB is the health insurance, private health insurance company we're with.
Yeah, just so that people who are listening sort of don't go, what's NIB? It's, yeah,
Just
Yep.
a health fund, HCF, Medibank, private,
quite a few.
So for our overseas listeners, so in Australia, we have our standard, I guess, socialized healthcare, which is called Medicare, which is run by the government, but you also have the option of private health insurance. And unlike some other countries, you can actually select who your insurer is because it's not actually tied to your employment. So it's something that you can select for yourself. So yeah, for our overseas listeners, this may not fully apply to you because there could be other IVF options in your country and PGD options. So, yeah, sorry, I just wanted to put that out there
Yep.
because
And
it's
this,
important.
sorry, Jono, this episode's just more like, don't fret for people who want kids. You have options.
Yeah.
And the
100%.
doctors and nurses we had, absolutely lovely. I'm sure they're lovely everywhere, but the ones we had, the company's called Genea, Genea. When we first went to see the doctor in his office, it's a proper suit and tie and everything. But when he came into the hospital, jeans, t-shirt, he came up, gave us a hug, saying, "How you doing, guys?" Um, yeah, I can't compliment the that place enough.
I know for me as well, I had a blood test done for genetic testing for NF, which then helps down the track when it does come to family planning because I think then that opens up a few more doors for potentially funding depending on what happens with the Medicare system in Australia between now and when that time comes.
I think I was the same as well. A couple in January, I think it was. I got the blood test done and it got sent back to America. I haven't heard anything back from it yet. So, but I am seeing the skin clinic on Friday, so maybe they can give me my result.
It
Yeah,
does take ages for them to get the result. I think I had my blood test done in like, it took about 6 months to get the results.
Yeah,
yeah.
yeah.
I had to chase them up. It was about 6 months, and they said, "Oh yeah, we forgot about that. Sorry, we forgot about you." I'm like, "Oh my god."
That's the Australian
The
healthcare system.
joys of a public health system.
Yay.
So Bernie, I do have a question for you. For any, like, I guess, like for anyone who is going through this process, obviously I know technology and all these things would have changed over the time, but were there any gotchas that you kind of got caught up in that you can sort of give people a bit of warning about so then they can sort of avoid those pitfalls or traps or anything like that?
Um, Also, talk to your employer as well, because like, oh look, this could happen last minute. Um, because the hormones are hormones. You gotta go with it. Um, what was really weird, and try not to give too much information. My wife was due to go to the hospital pretty last minute, and they warn you. And I was given a cup, and they said, "Look, take it home. It could be last minute." So yeah, I had to go into the bathroom last minute and put my donation in the cup. My wife had to go. I had to go to work, and the nurse said, "If this happens, put the cup in between your boobs because that will keep it at the most perfect
Ideal
temperature
temperature?
as possible." And we live about an hour away from the hospital, and I just find it mind-boggling. Still find it mind-boggling that I had to give my
I would have
donation in
thought
a
they would
cup
have
like
said just whack
that.
it in the I would have said they would have said just whack it in the freezer because I thought maybe you have to put it on ice or something,
No.
which would be hella awkward.
Yeah.
All right, we
Um,
will restart the Zoom and come back in so that hopefully we can restart straight away this time instead of having that 10-minute cooldown thing. So if we all leave and then join the same link and hopefully it will be nice this time.
Yeah.
okay, and sorry, you were saying gotcha moments.
Yeah.
I know there's a 50-50% chance. But it still doesn't prepare you for, nah, sorry, it failed. Or what was the worst bit when our first cycle, we had one that was put in. No, the second cycle, um, and it didn't take.
Yeah.
The first one didn't take. So again, for people who are thinking about this, going to do it, it sucks. I'll be blunt. It just may not work, and nothing prepares you for it because yeah, you get all your hopes up as that's just human nature, but it still messes you up. And it was very hard not to drop the F bomb there, Kirsty.
So, so I guess what you're trying to say is hope for the best, but prepare for the worst.
Absolutely.
Yeah.
Absolutely.
And how did you have that conversation with your children about sort of, did you have to have that conversation or how did it come up?
Oh, I can't remember how it came up. We were just straight from the very start. I was upfront and honest with them. Uh, we did IVF to have you. I think maybe it started because my daughter asked why I had these lumps or what's that lump. So straight from the start, I mean, why wait till they're older? What's the point?
Yeah,
Um,
that's great advice, Bernie, because I'm sure there'll be a lot of people like, how do I explain to my future child
Yeah.
about,
yeah.
and I'm going to stop asking questions because I've already asked a lot and I feel like maybe I should stop talking. Sorry, guys.
And for the boys out there, feel no shame when you go into that room because you have to go into your room, make your deposit, and walk out. And well, the way it was set up where I was, you had to tap on a window. It's like, yeah, okay, here's my sample. Thanks. And it's, yeah, e- everyone knows what you just did. And to top it off, maybe too much TMI. Some of the magazines, I opened up one of the magazines, and there was a attractive girl in the magazine who was a spitting image of one of my wife's best friends. It wasn't her. It wasn't her. But I'm like, holy crap.
My God.
Yeah.
Yeah. So boys, have no shame. It's, yeah, lots of people go through it.
Yeah.
You got to have a sense of humor about these things.
No, that's awesome, Bernie, because I think there is a lot of shame around these kind of things. And I'm really hoping that through this podcast, we can take the stigma out of that
Mm,
because, and, like some people might feel that, oh, I've had to rely on the help of science to make this happen and therefore it's bad or whatever. But there's no shame in relying on science to help you because that's what it's there for.
And I think
Yeah.
also, like, none of us really want to pass down NF to anyone if we can help it, because, like, we've lived with it up until now and we're still going to live with it for the rest of our lives.
yeah.
And we've seen the impact firsthand it's had on us, but also each other and other people that we're going to bring into future podcasts. And yeah, it definitely doesn't discriminate, that's for sure.
And I wouldn't wish this on my worst enemy. So why would I want to wish this on my future,
Yeah.
like my future potential children?
Yeah.
For sure.
And um so just at this juncture, like I'm just going to put an appeal out there. If there's any women with NF who have gone through this process, we would love to have you on the podcast to talk about your experience from your perspective because
Yes.
obviously Bernie's a man, so he didn't have to go through the hormone injections for to sort of speed up the ovulation and whatnot. So he can't speak too much to that except for, watching his wife go through it, which probably sucked just as much.
Yeah.
And I think with that as well, we're also like happy with however much you are willing to share. Like, it doesn't have to be in huge detail. Anything you're willing to share about, even some tips for people that might be starting that journey, that could help them and make it a little bit of an easier process, because like we know it's a hard process to go through. And there's a lot of challenges that come with that process for not only the female but also for the male involved. Um, just like as a family as well, like the stress, I'm sure, of that process can be a lot. So yeah, we're happy to have as little as much information as you're willing to share if you're willing to come on board.
So,
Also, if you're a doctor who actually does provide IVF care and this kind of help, like, we would love to have you on our podcast as well because maybe there's something that you can offer in terms of advice or just reassurance about this process to sort of give people some insight to sort of, I guess, demystify it and maybe take the scariness out of it as well. That would be amazing.
yeah.
Definitely.
And it's just human nature to be scared anyway. Um, just a quick step back, just very briefly. Not only did we have to see a psychological counselor, we had to see a genetic counselor as well. I still don't understand why, but I'm so glad we did because um, I recently had major surgery just before we started this process, and I just went white all of a sudden. And he just looked at me and said, "Are you all right?" And I said, "Yeah, I just got a headache." And he said, "Oh, that's normal for people with NF." I'm like, "What? I did not know this." Um, Well, and I was just over 30 at the time, and thinking, how did I not know that all my life I had all these headaches, not wondering why? And yeah, it's amazing what you can learn from that.
Mm. What was your experience with that genetic counsel? Like, obviously at the time, like you sort of mentioned then that you sort of like, oh, what's the point of this? What were some of, I guess, the key takeaways from that support that you were given?
It was more just explaining. I think the percentages and everything. We didn't. I think we had one meeting with him, or maybe two, but they were very brief. I'm sorry, once again, I can't remember the full details of it because it was so long ago. Back then, I had no idea that I'd be doing this today. I would have taken notes. Um, no, no, seriously, I would have. Because
Who would have thought that you'd be on a podcast
I
or that
know, right? Back
podcast
then,
would
what's a
exist?
podcast?
I know.
Um, I've lost my train of thought now. Um,
Sorry.
just like when we have these NF camps,
Mm.
telling the other people, uh, I get really excited to tell them like, oh, I'm never going to have kids, and I'm like, but wait, you have options.
Mm.
Mm.
No, like,
And a
thank
huge
you,
shout out
Bernie.
to my parents, not that they watch this. A huge shout out to my parents who helped us financially for the third and fourth cycles, because without them, it's highly likely would be a one child family.
Yeah.
And just thank you so much, Bernie. Like, I can't express how much what you're saying is going to help some young couple out there who are sort of staring down the barrel of should we have kids, should we not have kids, what are the risks? Like it can be so overwhelming. And so
Yeah,
just thank you for sort
Mm.
of opening up like this because you're going to make a huge difference. And it probably seems like I'm just saying that, but I'm sure for like it might even not impact one of our direct listeners. Maybe someone who listens to it knows someone who has
yeah.
Yeah.
another genetic condition who are like, crap, I have this genetic condition. Because this
Um,
goes
Yeah.
beyond NF. So,
And I
Yeah.
did you
think,
remember Jordan? Did you meet Jordan at the camp
yes,
Yes.
in Canberra?
yeah.
yes,
Yeah,
yes.
Yes.
she
Yes.
reached out. Actually, I think around the same time we were first talking about this podcast, and she wanted details. Was in Canberra. I was telling her, "Oh, look, you got these options,"
I reached out
and
to her
she
today,
seemed.
actually. Um, yeah.
Yeah.
Sorry, Benny.
She just got married. Jordan and Jordan, they got married.
Yeah.
Yeah, they did
May
too.
maybe let's not share too many details just to sort of protect their privacy.
Sorry.
No, that's okay. Just flagging that.
Yeah.
But yeah, so just the fact that Bernie just spoke about it at a camp and now another young couple are like, oh my God, this isn't
Yeah.
over for me. So,
Yep.
And
Any questions? I'm not too embarrassed. I mean, I think I just proved that I'm not too embarrassed to give too much information.
so we
I'm more
will
than
at
happy
Bernie in
to
the comments.
answer whatever I
Yes.
ask me any question, and I'll answer it to the best of my ability.
Yeah.
Yeah, I'm not shy about it, or yeah, I won't shy away from it at all.
and I think also
So,
just a quick shout out to Bernie as well. We did throw this on him last minute. We had a bit of a last minute change with something we had organised for tonight's recording. So to still keep a podcast coming out on that regular basis, we did sort of throw Bernie in
Yeah.
the last minute to do this. So
we have asked Bernie to sort of do this in the past, but because we
Yeah.
had guests lined up, we thought, okay, we'll make it a later podcast topic. But yes, the guest we had queued up today couldn't make it, and so there was a bit of a scheduling snafu. So I threw poor Bernie under the bus,
Yeah.
Anytime.
which I should be very careful about because Bernie knows where I live.
oh dear.
I don't.
I do too.
I
Actually,
don't
I've been there
actually. I
too. You
didn't
can't.
didn't go to
I've
your
been
Yeah.
there
place.
once.
Yes.
I guess that's the good thing about moving out into my own apartment or unit. You guys don't know my address.
We
Actually,
You
we
do.
know my
do.
I heard that.
All
Kira!
right, let's bleep that out.
Hey, and I thought I was going to be the first person to drop the F-bomb.
If it's
I thought Bernie was
actually
too,
technicality, if it's a PG rating, we can have one F bomb in it
per episode.
per episode. If it's a
There you go, Bernie. You're safe.
Oh, I can't. Kira already said it.
anyway,
I
True
mean,
crime
for the next
episode, Ben.
episode.
Let's
anyway,
make it a true crime episode.
anyway, going
Or we could just all say it now and make Kirsty work hard for her money.
anyway, like
Yeah.
going back to
So
IVF and that, my mum and I have always had this conversation since I was 13, 12 or 13, I think. I've always known that I wouldn't be able to have kids naturally. But now knowing someone who's gone through it, I feel comfortable in like asking questions and guidance and things like that. Like, if you're a parent to a child with an F, have these open conversations. Let them know that they might not be able to do it naturally when they come to age. Be open, be honest, and then they will have that open mind about what is to come for the future for them and for their future partner.
Absolutely.
100%, Kira. 100%.
Yeah.
And I think
And
also by having those conversations earlier, it allows young people to start asking questions earlier and actually gain their own understanding. I think too often young people aren't given the chance to build their own understanding and they're just told, oh, you need to do X, Y, and Z. And that's well and good in some ways, but also it means that they're more likely to take risks if they aren't actually given all the information and the flexibility to ask questions without, being judged.
yeah. And I tell you, it's when we were going through all this, I was so tempted to just take the risk and do things naturally. Yeah, it's a lot of pressure. It's a lot of pressure because
So,
some
Bernie,
people just like, there's nothing wrong with him. Just do it.
yeah.
Just have the baby.
Yeah.
And Bernie, so when were you told that you would need to actually go through this whole process to have kids that didn't have NF, if that makes sense? When did you find out about this option?
Let's see. I think 2007, 2008.
Yeah.
Yeah, we thought, well, what are our options? We should go. Let's go and talk to our GP. It can be as simple as that. I mean, how many times do you see your ad? Not sure about something? Ask your GP.
Yeah.
Do some research. If you're not happy with the response, get a second opinion, get a third opinion. I was just so fortunate that my GP was awesome. I had him from the age of 2. Unfortunately, he had to retire about 5 years ago. But so he knew my condition. He knew I inherited it from mum, so he knew mum's conditions. And he had a really good network of basically everything. He was an amazing guy. But yeah, that's all I can say.
So
We
that's solid advice there. Ask your GP.
Mm.
Yeah, just ask the questions. What are my options? And that's how we came with it. Because back then I thought, oh, I don't know if I can have kids. We may have to adopt. I don't know. But yeah, please, everyone who's listening, ask your GP, not just for the NF stuff, but anything at all. But that's, yeah,
And I think also, like, if you have a GP that's not maybe the best and you're kind of stuck for whatever reason that might be, if you're seeing a specialist or someone who might be sort of overseeing NF care or your medical conditions care, ask them, like ask any medical professional you see that has a role in your life for their second opinion or a recommendation of who you can see to be able to actually, I guess, get further support and answer your questions that you're like, oh, I don't know about this. Strongly encourage you to seek those opinions as you need, and don't feel like you're stuck just to your general GP, because sometimes there are other people out there that will also be able to help if you're not sure.
And don't
Yep.
don't
Yeah.
don't be afraid to get a second opinion.
I was just going to say that. Thanks.
Yeah. And stay away from Dr. Google, please.
Yes.
Yeah. Yes, because Dr. Google can sometimes scare you.
Oh, you got a
As
tumor.
well.
You've got cancer. You're gonna die. That's not the case.
No. And and the thing is, like, not all GPs have been exposed to neurofibromatosis, so they may not have all the answers. If you are fortunate enough to be connected with the Royal North Shore Hospital here in Sydney, there is an amazing clinical nurse there called Martin, and he's awesome. And funnily enough, his surname is Good, so he's really good.
Yeah.
I think I'm seeing
Um,
on
Actually jealous
Friday.
of you guys in Sydney, like so tempted to move there just for the NF care.
Just
But
move here.
you didn't want to move for us?
Move to
look, I would love
Newcastle.
to, but I also have 3 jobs here in Adelaide, and 2 of them I can't easily transfer
Yeah, that's fair.
where I'm
That's
working.
fair.
Well, I can because it's a corporate company, and well, they've got places everywhere. But
Yeah.
look,
I'm
yeah.
pretty sure my work is looking for people. Just come work with my company.
Look, and then I can just gate crash your place, right?
Yeah, and then I will actually have another friend at work.
Do you need a housemate, Kira?
I've only got 1 bedroom. It's a
Fair
1
enough.
Well,
bedroom
I'll have the
unit.
couch then. I'll have the couch then. It's fine.
It's super comfy too. I've slept on it multiple times.
Or a trundle bed, you know. Go back to like being a 5-year-old.
Well, I've got a queen bed. We could just sleep together.
That's true.
And then we can see each other in person more
I
often.
know.
Exactly.
We can make regular trips down to Sydney every weekend.
Yes. So depending on which state you're in, I'm sure there's great NF clinics there as well, because we've got some pretty good doctors here in Australia. So reach out to your NF clinic and I'm sure they can offer you or point you in the right direction for advice for your city or state on where to get help with IVF. And as Kira said, don't be afraid to get a second opinion because you are entitled to
Yes.
that. And because NF even though it's a very, very common genetic condition, it's a very little understood genetic
Yes.
condition. And I'm sure all 4 of us here have had that experience where you tell the doctor, "Oh, I have neurofibromatosis," and they say,
What?
"What's that?"
Yeah.
But also
Yeah.
they don't know the things to check. So things like blood pressure should be actually checked very regularly. We do have a higher chance of our blood pressure causing issues. So if you are seeing a GP who's like, oh, I've never heard of that, there are fact sheets available on the Children's Tumour Foundation website, and a little bit for GPs as well about what they should be checking for. But also use that information for yourself to help educate your GP if they don't know what NF is, because getting on top of things like blood pressure early is really important.
Yep, absolutely.
Yes.
Which brings me to another point. The NF fact sheets that are out there, like all the symptoms that you can have, not everyone will get every single one of those NF side effects. I don't know what to call them.
Symptoms.
Because I'm one of what Kirsty just said reminded me. I get my blood pressure checked every time I go to the GP, and it's always perfect,
Same.
all the way it should
Knock
be.
on wood.
Yeah, knock on wood, exactly. I've got a wooden head. Um, some people don't get lumps. Some people don't get the headaches. Some people don't have the learning difficulties. So, yeah, for those who read up on it, you're not going to have every single one of those things,
Yeah.
if that makes sense.
Yeah. So yeah,
I mean,
and that comes back to what Bernie said right at the
yeah.
beginning that everyone's genetic mutation for NF is slightly different.
So
So
I was gonna
if you think
say,
of it as a book
I was,
with a spelling mistake, yeah.
yeah, the book method, like I explained in the first episode, I think, or the second. But I mean, look at the
One of them.
four of us. It has manifested differently in every single one of us. You know, my friends Becky and Nicole,
Yes.
Yeah.
they're identical twins. They both have NF, but it has manifested differently in both of them.
And they're identical
And they're
twins.
identical.
They
I think I was talking to Beck and, or yeah, I was talking to Beck and she was saying to me that a doctor said, "Oh, you're identical twins, then how come you don't have tumors in the same spot?" And then she had to explain that it manifests differently in both of them. Yes, they're identical, but they're still their own people. Their tumors have just developed in different locations.
Yeah.
so yeah, just if you look at Kira, Kirsty, and Bernie, you can see that they don't have a lot of external tumors, whereas I've got loads.
Yeah.
And and I don't think Bernie, you don't have any of the internal plexiforms, do you?
Oh no, I had one cut out.
Yeah.
Yeah.
So Bernie had one that he could cut out, whereas I have an inoperable one. Well, not inoperable, it's just too, it's not very
Yeah.
safe to operate on.
It's like most of mine are internal
Yeah.
plexiforms, and I've just got to get
And
an MRI done every 18 months, 2 years really, just to keep an eye on them. But they mainly do my head. I haven't had a whole body one done in a long time, which I should request, but they
I've
won't
never
do
Yeah.
it
had a full
because
body one.
I'm a female, and with the radiation, it could mess up. This is what my mother says. It could mess up my reproductive system because of the radiation.
so MRIs actually do have a more minimal radiation compared to, say,
Mm,
X-rays or CTs
X-rays.
or PET scans. So PET scans
Yeah.
are the really crazy one where they actually tell you not to go near pregnant women or and young children for about 6 hours after you have a PET scan done.
Yeah.
I was never told that when I had my PET scan, so I don't know if they've changed the recommendations or if they just failed to tell me that.
I think they failed to tell you that because even about 10 years ago when I had a PET scan, they gave me the same information. And I was like, and in my head, I'm thinking, dude, I'm in a hospital. I'm going to go past pregnant women and young children a lot. But I think what they mean is not being in close contact for like an extended period of
Like
time.
my workplace, because I work with babies 0 to 2, and then I also work closely with like like the 2 to 5 year olds.
Yeah, and you probably encountered the mums who are possibly pregnant.
I do have quite a few parents at work that are pregnant, and I can't wait to meet the little babies.
How
Yeah.
sweet.
But yeah, back to the MRI thing. I've never had a full body MRI. My person I'm seeing at the moment, who sent me for the PET scan recently, has requested a abdomen MRI with my head and spine for my next one. But I've got a softer tumor on my foot, which has never been looked at properly. So I'm surprised I haven't had a full body MRI yet. But similar to you, Kira, I probably need to actually ask for that because
Yeah.
I imagine there could be tumors growing that we don't know
I've
about.
had a full body
Okay.
MRI.
I've never
They're
Um,
had one.
fun. You just lie there and you go in and out, in and out, in and out. That's what I've done in the
but
past.
you get very and you get very
You
warm.
do get very warm. Yes. Like you're freezing, so you ask for a blanket, and then halfway through you're like, "Oh, I'm too hot," but you can't take off the blanket.
See,
Yeah.
I get
So you know how they give
spots
you
when I
Yeah.
go
the
into
little.
they it depends on when you
So I actually had to
Yeah.
squeeze the thing.
Oh,
yeah
I just tough
when
it
I
out. Sorry, Kirsty.
Oh, I got really hot. Like I started roasting, so I was like, okay. I toughed it out, and then it got to a point. I'm like, nah. And I squeezed it, and they're like, is everything okay? And I'm like, can you take the blanket back off?
Yeah.
See, I don't know. I've been fine with MRI. I've never been too hot. I've always had a blanket, and then I've had scrubs as well. Because where I've had mine more recently, they get you to change into like nurse
Yeah.
The
scrubs
robe.
basically.
Yeah.
Which is so much more comfortable than like the gowns that other places get you to change into. The hospital gowns aren't very comfortable.
Yeah. So,
Yeah.
whenever I've got my hair done, I've been able to leave my pants on, just depending on what pair of pants I'm wearing. But if I'm wearing like my active gear, I'm allowed to wear those tights just as long as I take my top and bra off, because it's only just
The
my
metal.
head. It's just my
And it's the
head.
metal as well. Like you don't want metal to go onto an MRI machine.
Yeah.
Um, because yeah, that's
We've
not
all
gonna
seen
end
the
well.
movies and TV shows where they get
Yeah.
I had a head MRI and they let me keep my jeans on, even though there's like a metal button in the jeans. And I was like,
um
I was very nervous. But anyway, I think we'll wrap up here,
definitely before we get too
because also
distracted.
running out of recording time. So thanks everyone for listening. And as always, if you'd like to share your story on our podcast, we would love to hear your story. And as I said earlier, if you're a doctor who's in the IVF field, or if you're a woman who's gone through the IVF PGD process, and you want to share, please reach out to us and join the rebellion.
See you on the flip side, rebels.
Just remember, you're not alone. Bye.
Stay strong, my Pebbles Rebels, and keep waddling.